So today let's discuss about warts. Warts are of two types. One is cutaneous warts and the other is anogenital warts. Cutaneous warts usually caused by human papilloma virus type 1, 2, 3 and 4, mostly by 2 and 4 and followed by 1 and 3. We will focus mainly on the treatment options. So the first line treatment is salicylic acid in the concentration of 12 to 26% for equal to or more than 3 months. It can be combined with 5-fluorouracil or lactic acid. For example, the Dupilum, most common brand available in Pakistan, is the combination of salicylic acid plus lactic acid. But this treatment should be avoided on common warts, which can also be called facial warts. So the best option in facial warts is laser. Laser is best option. So which type of laser? Pulsed dye laser is mostly used. Then ERYAG and DYAG. These can also be used. But avoid CO2 laser because of the two reasons. One is post-operative pain and the other is scarring. Okay. The second line option in cutaneous warts is cryotherapy, which is mostly not available in every center. Not available in every center, in most of the centers. Okay. Then the second option is electrocautery. But the problem here is during the procedure of electrocautery, this produces plumes, which has high viral particles. So the surgeon doing this must follow personal protective measures. Okay, the excision should be avoided in cutaneous warts because of the two reasons. One is scar, and the other is high recurrence. So that's why excision in the cutaneous warts should be avoided. The third line option is podopylene or podopilotoxin. These two are antimitotic in nature. So how the salicylic acid and the lactic acid or 5-fluorouracil treat this warts? The mechanism of action of salicylic acid usually in the concentration of 12 to 26% or this. It actually thinning up the warts and stimulate inflammatory response. So this response usually takes 3 or more than 3 months. Inflammatory response. So that's why these are advised for 3 or more than 3 months. Now let's discuss genital warts, which is also known as condyloma acuminata. It is usually mostly caused by low risk HPVs like HPV 6 and 11, mostly by this 6 one. 45 to 70% of cases are due to HPV 6. The commonest sites in this case are in main frenulum, corona, glans, while in female posterior foresheet. Let's discuss about the treatments. In this case, the first line treatment is podopylene, podopilotoxin in the combination in the concentration of 0.15% or 0.5%. This is prescribed as twice daily for 3 consecutive days in week for 4 consecutive weeks. It is contraindicated in pregnancy. It is also comes in the concentration of 5%, which is uh, given 3 times per week for 16 weeks, or 3.75% concentration, which is uh, given twice daily for 2 weeks, uh, and then uh, repeat this after 2 weeks. Repeat this after 2 weeks. The second option in the anogenital warts is cryotherapy or cautery, or even you can do surgical excision. In cutaneous wart, we usually avoid surgical excision, but in genital warts, you can do surgical excision. The third line option is interferon, especially when the patient is immunocompromised or not responding to the above treatment. One thing you should remember that in children, whenever children came with the genital warts, it is usually in two-thirds of the cases the genital warts are actually the common warts. But when a adult came with the genital warts, only 1 to 2% of the cases are actually common warts. So the genital warts have high infectivity and usually associated with the sexual activity.